How does the brain recover vision after stroke? Have you ever wondered how the brain can recover vision after a stroke? The journey of vision recovery is fascinating and involves several complex processes. When a stroke occurs, it can damage areas of the brain responsible for processing visual information. This damage can lead to conditions like hemianopia, where a person loses half of their visual field. The extent of recovery largely depends on the location and severity of the brain injury. One of the key players in vision recovery is neuroplasticity. This is the brain's remarkable ability to adapt and reorganize itself. If the primary visual cortex, which is crucial for processing what we see, is still partially intact, it can help support vision recovery. Surviving retinal cells connected to this area can continue to function, which is essential for regaining vision. However, if the visual cortex is severely damaged, it can lead to permanent vision loss as those retinal cells may degenerate. Rehabilitation plays a vital role in the recovery process. Techniques like visual training can help retrain the brain to process visual information using alternative pathways. Think of it as physical therapy, but for the visual system. Patients often start with no vision in a certain area, then may progress to sensing motion, and eventually to partial restoration of vision. While it may not return to normal, some individuals regain enough vision to engage in activities like driving. Interestingly, spontaneous recovery often occurs within the first few months after a stroke. This recovery can be influenced by factors such as the initial severity of vision loss and the size of the brain lesion. Generally, partial visual field defects have a better chance of improvement compared to complete loss. Vision rehabilitation can include various techniques, such as visual scanning training. This method teaches patients how to compensate for blind spots by consciously scanning their environment. Occupational therapy and optometric rehabilitation can also enhance skills like visual memory and depth perception, which may be affected by the stroke. In summary, recovering vision after a stroke is a multifaceted process. It involves the preservation of the primary visual cortex, brain plasticity, structured visual training, and spontaneous recovery, especially in the early months. Patients are encouraged to collaborate with neurologists, ophthalmologists, and rehabilitation specialists to create personalized treatment plans that cater to their specific needs. This approach aligns with current scientific understanding and emphasizes the importance of early intervention and rehabilitation in maximizing visual recovery after a stroke. Always consult healthcare professionals for personalized advice and support throughout the recovery journey.